How's everybody doing? This is Dr. Emad Rahim, Dean of Social Impact here at Claremont Lincoln University. I'm here with Gabriel Maldonado,
Here.
CEO of TruEvolution.
Yes.
And you do a lot of amazing work, but I don't think everybody knows what you do in your
Yeah.
organization
Yeah,
and
yeah,
the important piece of it, right?
Sure, sure.
Can you describe to us what
Yeah.
exactly the organization do and your role in it?
So, the organization has gone through an evolution, no pun intended on the name. But we really focus on advancing health equity and racial justice for LGBT communities. And our focus is really looking on the quality of life and human dignity of LGBTQ people. And we try to focus more so on communities of color. That's really where our focus is as a service provider and as an advocacy organization.
So do you think there's that ingredient that's missing that a lot of organizations that work with HIV and AIDS that they are not focusing in on, that they're not providing?
Yeah, HIV is, it's a human issue. It's a human rights issue. It's a civil rights issue. It's a social justice issue. And one of the largest contributors to why HIV is so high, particularly amongst communities of color, is because of the historic racism that has existed in the public health and the healthcare system for so long, going all the way back to the Tuskegee experiment.
Yes.
And the distrust that communities of color, and frankly, some of the challenges that the healthcare system has had in really trying to understand, outreach, and create programs, interventions, and services that speak to the lived experiences of diverse communities.
Wow.
Yeah.
Well, that's powerful. That's powerful. That's really powerful.
It's powerful, yeah.
Now, why did you get involved? Like, why did you feel that you had to be this change maker? Why did you feel this social impact, like you had to be the champion of this?
It certainly doesn't start off like that.
Yeah.
I am a Afro-Latino. I was raised by a single mother, a black mother. I'm a gay man. I'm a person living with HIV. And I started my organization, it'll be 11 years this November. I was 19 years old. I'm gonna be 30 now. And for me, it just started off on this yellow brick road of just trying to understand myself. I was trying to figure out a way to overcome some of the barriers and the stigmas and the racism and the homophobia and the challenges with poverty that I experienced. And I think along the way, you discover that your story is very mirrored to so many other people in your community. And I think becoming an activist or becoming an advocate or a service provider or a nonprofit leader, it sort of happens along the journey, and at some point it becomes intentional.
Wow, I'm emotional. So why Claremont University and why now?
Well, Claremont is an amazing institution. And I think that one of the reasons why that myself and my organization has worked so closely with Claremont Lincoln University has been because of your commitment to social innovation. And that is a new concept, this idea of innovation, because historically, in many of the traditional settings, whether it's the nonprofit sector or the public health sector or the medical sector, or even I have a degree in business, I have a master's in business administration, even in the business sector, we've operated on these very traditional models of how we think civilization, society, and social engineering should be governed. Right? We've had these kind of archaic, antiquated ways of approaching things. And I think now more than ever, institutions, academic institutions, public health institutions, the healthcare system, we're realizing that how we've done things can't be how we do things moving forward, and that the world has changed. The world has changed. And I think it is fundamentally critical for institutions like CLU to be engaged in conversations around social innovation, around creating and molding and sculpting the minds of the next generation that can lead our society, lead our civilization, lead nonprofits, lead businesses, lead a variety of social enterprises in a way that truly advances society, that truly moves us to the next plane of where we are going as a people. And so I'm just honored to be here. I'm honored to share space with CLU, its students, its faculty, its administrators, its curricula, its academia. You are all very innovative, and I think more people need to be involved in the work, in the education that you are doing, because you're paving the way for our next generation.
Wow, wow.
Yeah, you
I
are.
don't think I could ever say it, you know, at that level that you articulate.
Oh
That-
no,
that's
trust me, you're
wonderful.
doing it. I just articulate it, but you're doing it. You're the one that's actually doing what it is I'm speaking on, and so really the credit belongs to all of you who are here in the institutions doing that. And I'm blessed that I can articulate that for you. You know.
Yeah. So thank you so much, Gabriel, for your insight, and we're honored for your presence.
Thank you so much. Thank you to CLU. Thank you.
Thank you.
Appreciate it.
Thank you.
Yes.